I am sure you have enjoyed the conference thus far. You've had lunch. I've had 2 donuts and 2 cups of coffee, so y'all know I'm fired up and ready. Yes, earlier this morning we were slow rolling, but things have been going very well thus far. The vendors are fantastic. I hope you have the opportunity to stop by to see the vendors. For those of you that weren't in here this morning, my name is Christiana, and I'm here today. People are like, are you hosting? Are you the moderator? What are you? I'm keeping things flowing. They're going to flow right on through, right? We have Mr. Roland Martin here with us today. In the Benny Thompson Center, right? Again, please give Tougaloo a round of applause. It's a beautiful facility. So far, you've had the opportunity to go to many different sessions. Breathe Easier, talking about lungs, lung cancer, and health equity in Mississippi. From Scrubs to Strategy, the future of the Black leadership in medicine. Also preventing aggression and healing emotional pain in Black men, the unhealed wounds. Ooh, that was a good one. And the heart of the matter, talking about cardiovascular disease, kidney, and much more. Also, Toxic Truths, unmasking environmental injustice. There have been many different sessions, and there are still plenty more to go. But before we continue on, we want to hear right now from one of the people from the council. Give me a second. He is the Institution for the Advancement Minority Health Board Vice Chair of the Black Men's Health Equity Conference, Mr. Nick Locke. Please join us.
Thank you. Good afternoon, everyone. Just a point of personal privilege, I'm actually here to speak on behalf of our mayor as Director of Communications, but point of personal privilege, as Vice Chair of this board, I want to say that I'm very proud of our leader, our President, CEO, Dr. Melvin. Thank you to you and your team for continuing to put on this conference and putting a spotlight on the issues that are important for the health of Black men, and I do appreciate that. Thank you. She's also a longtime friend. So, the mayor really wanted to be here. He called me this morning and said that he had something else come up and could not attend. He was looking forward to being here with Mr. Roland Martin, but he unfortunately was unable to attend. I don't want to say on cameras here, but I want to bring greetings to you on behalf of the City of Jackson. I'm honored to welcome you to the 2025 Black Men's Health Equity Conference, hosted by the Institute for the Advancement of Minority Health. This year's theme, Prevention, Power, Progress, reflects powerful commitment to creating real and lasting change for Black men's health. The City of Jackson proudly supports this vital work to eliminate health disparities and empower the community with knowledge, resources, and advocacy. From addressing the harms of tobacco and vaping to tackling heart disease, prostate health, mental wellness, environmental justice, and more, this conference represents the kind of focused, solution-driven collaboration that uplifts lives and strengthens futures. As you gather here at Tougaloo, sacred ground for civil rights and social change, the mayor encourages you to draw strength from its legacy and inspiration from one another. Let this conference be more than a moment, let it be a movement. Thank you for your continued dedication to health equity. I wish you a successful and transformative experience. Mr. Martin may not remember because he, for years, served on several panels for CNN, but I once appeared with him on a CNN panel with John Legend. It's been several years ago. But I enjoyed that experience, and the mayor.
You sure you enjoyed that experience?
I did. You kicked my butt a bit, but I didn't forget it.
I just want to make sure he said it himself.
Well, seems like you do remember. But the mayor wanted to present a proclamation honoring you, Mr. Martin. Whereas Roland S. Martin is a nationally acclaimed journalist, political analyst, author, and advocate whose distinguished career has been defined by an unwavering commitment to truth, justice, and the empowerment of African American communities. And whereas Mr. Martin serves as the host and managing editor of Roland Martin Unfiltered. Who watches Roland Martin Unfiltered? I do. Keep informed. And CEO of the Black Star Network. Dr. Greg Carr is I'm a fan, huge fan of Dr. Carr. His platform that provides critical analysis, cultural relevant reporting, and unfiltered perspectives on issues affecting Black America. And whereas his powerful voice in media, civic engagement, and social justice has elevated public discourse and inspired generations to become more informed, active, and accountable citizens. Whereas the Institute for the Advancement of Minority Health has invited Mr. Martin to serve as a keynote speaker for the 2025 Black Men's Health Equity Conference, an event dedicated to addressing disparities and promoting wellness among Black men in Mississippi and beyond. Whereas the City of Jackson commends Roland S. Martin for his enduring contributions, journalism, advocacy, social change, and proudly welcomes him to our city. Now, therefore, I, John A. Horn, Mayor of the City of Jackson, do hereby recognize and honor Mr. Roland S. Martin for the exemplary leadership, visionary voice, and commitment to uplifting communities of color, in witness whereof, given under my hand and seal of the City of Jackson, this, the 23rd day of August, 2025, John A. Horn, Mayor of the City of Jackson.
Appreciate it.
Thank you very much. Enjoy the conference.
Thank you so much, Nick Lott. Now, just want to remind you, this is, what I'm about to say is kind of like church, okay? So when people start to come in, and if you're sitting on the end and there's some empty seats next to you, if you would kindly just push down a little bit so that the people can then sit coming in off the ends. I know it's hard to maneuver around people. Why are you trying to
be so nice?
Well, I'm trying.
Move the hell over.
Yeah.
And y'all stop being scared sitting down front. All these seats up front, y'all trying to sit all in the back.
Yes.
Okay, there you go.
Very well said. Very
See,
well
I ain't
said.
have no 2 donuts and coffee. I had pancakes, eggs, and bacon. That's how
Well, consider the fact that I'm in the Benny Thompson Center and I'm at Tougaloo College. You just have to understand where we are, the esteem.
Girl, stop trying to
I'm
be bougie.
trying to be professional.
Ain't nobody tripping about no Benny Thompson, that little capper.
Do we have any other politicians in the place with us today? Anybody else, if you would please stand so that we could recognize you. I do see Mr. Charles Taylor here from the NAACP, so we would like to thank you for attending on today. We have our lovely ladies from the Jackson Advocate. Do you have anyone else here that would like to be recognized? Don't be shy. Just wanted to make sure I take that time. Well, now we will have a video.
The Institute for the Advancement of Minority Health and Tougaloo College are proud to welcome a distinguished voice in American journalism, an advocate, an author, and a table shaker whose work informs, challenges, and inspires. Mr. Roland Martin is the host and managing editor of Roland Martin Unfiltered, the first daily digital news show to deliver an unfiltered analysis of politics, culture, and current events through an African American lens. He is the visionary behind the Black Star Network, a multimedia platform dedicated to empowering Black communities through truth-telling and storytelling. Mr. Martin has interviewed U.S. presidents, world leaders, and sparked national conversations that represent the voice and power of Black America. A 4-time NAACP Image Award winner and National Association of Black Journalists Journalist of the Year, his body of work spans decades of excellence and impact. A life member of Alpha Phi Alpha Fraternity Incorporated, Mr. Martin is also a tireless champion for health equity, especially for Black men. Today, he will bring more than just perspective. He will bring passion, purpose, and yes, he will bring the funk. Please welcome a national thought leader and a voice for the people, Mr. Roland S. Martin.
I know you all have seen Mr. Roland Martin many different places, and not only is he an advocate, but he definitely raises a lot of questions and issues. To make sure he brings it to our attention, he makes us also think about it in a different way. You just never know. But to better...
And he might cuss.
To better tell us a little bit about Mr. Roland Martin, it's Mr. John Smith. He's the Assistant Provost here at Tougaloo College. Will you please join us? George? Yellow? I had already turned it on. So my problem is, I don't like to share. I'm not an only child, though.
Mic check, 1, 2.
It's them 2 damn donuts and that coffee.
Good afternoon, good afternoon, good afternoon. I have the esteemed honor and privilege of introducing a man who is not only a mentor, but he's also an alum of the same high school I went to, ironically, Jack X High School, Houston, Texas.
JY.
He's also a life member, and I'm a life member also of the greatest fraternity there is in the world, Alpha Phi Alpha Fraternity Incorporated.
The only fraternity. The rest of them youth groups.
It's an honor.
I got 2 mics in my backpack.
Over the course of a journalistic career that has seen him interview multiple U.S. presidents to the top athletes and entertainers in Hollywood, Roland S. Martin is a journalist who always maintained a clear sense of his calling in this world. Many have bestowed upon him the moniker, the voice of Black America. Martin is the host and managing editor of hashtag Roland Martin Unfiltered, the first daily online show in history focused on news and analysis of politics, entertainment, sports, and culture from an African American perspective. It was launched on September the 4th, 2018. On September the 4th, 2021, Martin launched the Black Start Network on an OTT network that features a variety of shows focused on news, culture, finance, wellness, history, and wellness. BSN is available on Apple and Android phones, Apple and Android TV, Roku, Amazon Fire, Xbox One, and Samsung TV. So there is no way that you cannot find Martin somewhere on your television. For the last 2 years, Martin has produced a twice daily commentary on iHeartRadio's Black Information Network, heard on nearly 40 stations nationwide, which I know we do have a Black Information Network here in the Jackson area. Martin is a sought-after international speaker, delivering speeches and lectures to numerous groups annually, electrifying audiences with his deep understanding of history, politics, and culture. He has been named 4 times by Ebony Magazine as one of the 150 most influential African Americans in the United States. In October 2022, Martin was named a Fellow of the Society of Professional Journalists, the organization's highest honor. In December 2021, he was inducted as the youngest living member of the National Association of Black Journalists Hall of Fame. In 2018, he was inducted to the Texas A&M University Journalism Hall of Honor. In his career, Martin has been showered with more than 40 awards for journalistic excellence, including being named Journalist of the Year in 2013 by the National Association of Black Journalists for his extensive focus on voter suppression and other issues of concern to African Americans during the 2012 election. Martin spent 6 years as a contributor for CNN, appearing on numerous shows and earning accolades near and far for his no-holds-barred honesty, conviction, and perspective on various issues. Mr. Martin is a life member of the National Association of Black Journalists, and he's recently been voted as the Vice President of Strategic Initiatives for the National Association of Black Journalists, a life member of Alpha Phi Alpha Fraternity Incorporated, and a member of Sigma Pi Phi Boule Fraternity Incorporated. He is married to the Reverend Dr. Jackie Hood Martin. They reside in Northern Virginia and the Dallas area. How about that? That man has 2 area codes. So at this time, without further ado, everybody's clapping. Everybody's clapping. Everybody's clapping. Ladies and gentlemen, give it up for Mr. Roland S. Martin.
Appreciate it. I'm good. I got it. Ain't no thing. You're going to get tuckered out with them 2 donuts and that coffee. So how are you doing? Okay, y'all can turn lights back on. Y'all turn lights down. Y'all turn back on. I like being able to see people. Glad to be here. It was an early flight out of D.C., but it was no drama, so it's all good. Glad to be back. Jackson, first time actually on the campus. I've never visited campus before. I think this is the 59th or the 60th HBCU that I've been to. So I'm certainly glad to be here and to see all of you on this particular Saturday. Let me also thank the folks who saw fit to invite me. I never take those things for granted or take them lightly. And so again, glad to see you. Let me also thank everybody who watches the show, who watches the network. It has been remarkable. It'll be 7 years, September 4th, since we launched the show. You know, there were a lot of folks when TV One canceled, News One Now, who were upset and they were really bothered by it. But I wasn't. Because I knew exactly what I was going to be doing. And literally, as Alfred Liggins was telling me the reasons behind them canceling the show, while he was talking, I was already planning. And so for me, it was easy transition going from linear television to going to the digital side as well. Because when I ran the Chicago Defender, I launched the first Black news source audio podcast in 2005 and the first Black video news podcast in 2006. So that was literally 12 years before I did this here. And so I was always ahead of the game. And the thing about it is that, we live in a world where our issues matter. And I think, what we have to recognize, and this speaks to also what I'm going to talk about, is we are literally operating in a space where we are seeing before our very eyes the death of Black-owned media. If you look at an Ebony and Jet, you look at any of these publications, you look at our legacy organizations, you look at how many of our Black newspapers are behind 10, 15, 20 years in the digital space as well. And so the greatest fear that I've always had is that we're going to be asking somebody else for permission to tell our story. And that is the absolute scariest thing, asking someone that doesn't look like us and know us, can you please tell our story? So it's important for every one of us to invest in, to support Black-owned media. It's not enough to say, oh man, thank you for what y'all doing, I'm praying for y'all. We appreciate that. But praying ain't gonna pay a light bill. And people always say, man, I wish y'all could cover this and cover this and cover this. Well, you can't do those things if you don't have staff. You can't do those things if you don't have resources. And that's really important. And when I launched this effort, I knew, listen, there are $350 billion spent every year on advertising. Black-owned media receives anywhere from 0.5 to 1% of that $350 billion. The federal government spends $1 billion on advertising. Black-owned media gets 1% of that. And so that's a huge reason why it's difficult for us to scale. And so when we launched this, I didn't want to do a Patreon, a subscription, because I knew folk could not pay $5.99, $6.99, $7.99 a month for our content. We wanted it widely available. Luckily, we've had some 36,000 donors that have contributed to the show in the network since we launched it, in excess of $4 million. We ask on average $50 each for a person for the year, but it's $4.19 a month, 13 cents a day. We've had people give $25, $10, $5, $1. We've had people give up to $30,000. That's important because if you look at our history, the Chicago Defender could not be what it was, the largest Black paper in the country, or the Pittsburgh Courier, or the Land Daily World, or Ida B. Wells and her paper, and Frederick Douglass, if Black folks did not actually subscribe to those papers. And so we have to understand that it's called mass media for a reason. Perfect example. You've got almost 200 people sitting in the room, but we're also, because I own it, I ain't got to ask anybody's permission, we're also streaming this right now on the network. We can actually restream this multiple times. We have nearly 2 million subscribers on our YouTube channel. So I don't believe in just talking to the room. I believe in talking to the nation and the world. You only can do that if you own the infrastructure. And for many of us, we support other folk. We support social platforms. We support other platforms. But too often, we're not supporting something that is ours, that we own and control. And the own and control part is what's most important. Because again, because I own it and I control it, I don't have to ask somebody, hey, can I please stream this? I say, stream this. It's a very short conversation. Again, that's the difference between owning and working for somebody else. And so that's why our platforms are absolutely important, critically important. So I appreciate the folks that watch, that subscribe, that donate, because that's how we've been able to build and grow and be able to travel around this country broadcasting all around, not just the country, but also around the world. I had a sister shot me in the airport this morning, leaving D.C., and she's Liberian, and she said, I really appreciate, she said, you know, you did a story. And I said, no, I just didn't do a story. I said, I was in your country for 10 days covering the 200th bicentennial. And same thing, people in Ghana and Ethiopia. And so that's what it means when we have the ability to own and control the platform. So let me get into my remarks. So I'm going to start with this here. And I'm specifically asking this question of the men in the room. Raise your hand if you invited at least one other brother to come to this event with you, and they are here. First of all, y'all know each other, so y'all don't count. So I don't know why y'all raising y'all hand. But anybody else, raise your hand. Raise your hand. Let me see. 1, 2, 3, 4, 5. Who you invite? How old are you? Right there in the green shirt. Who you invite? How old are you? How old are you? Speak up. How old are you? How old are you? You 6? You invited him? You invited both of them. Did he invite both of y'all? No, that ain't how that happened. I knew that wasn't the case. I knew it wasn't the case. All right. So now I asked that question for a reason. So about 5 brothers raised their hand. That right there, that very asking that question and that answer is part of the fundamental problem with why we're having this conversation. I say that because if we're talking about how do we impact the health of black men, how do we begin to change not just the conversation, but begin to change the outlook, it requires communication between one brother and the other. You have individuals in here who are fraternity members, individuals in here who are church members, who are part of men's groups. If you are, so I'll just do a roll call. Okay, so we already know there's only one fraternity, but we'll mention the other little groups. So if you are, I know he would look, he's a little cute Omega socks, and I was commenting on him. So if you're an Alpha, raise your hand. Okay, all right. If you are an Omega, raise your hand. All right, that's the flyway signal. Actually, that's what it is. Okay, if you're a Kappa, raise your hand. If you're a Sigma, raise your hand. You're an Iota, raise your hand. If you Prince Hall Mason, raise your hand. If you are Sigma Pi Phi Fraternity Belay, raise your hand. If you are in a church men's group, raise your hand. All right. So I walked through that. Now, if you are not in any group, raise your hand. Now, that's a whole separate speech, and that's a problem. Because Stokely Carmichael, Kwame Ture once said, show me any African American who has done anything to impact our community, they were always associated with an organization. And I say that because we actually have capacity in our community. The problem is we're not properly using our capacity in our community. I just named you numerous organizations where we have brothers who are involved. The problem is in many of our groups, we are focused on insular. We're focused literally on our internal business as opposed to how do we deal with the personal business. Very few men, period. I don't care whether you white, Latino, Asian American, Native American, very few men have the type of personal conversations that women have, especially when it comes to health. So you ask a brother, how you doing? I'm good. That's it. You may know more about their musical taste. You may know more about who they're dating. You may know more about them playing golf. I mean, I can go down the whole line. You may know about any of that as opposed to what is happening when it comes to their health. Because we have been conditioned, and this is part of the problem with men, we have been conditioned in this patriarchal society that a man cannot show weakness. That a man has to be strong, a man has to be resolute, a man has to be the provider, a man has to take care of all these different things. And the problem with that is that we have lots of men who are dealing with significant mental issues, anxiety, all those different things, and they are carrying the weight of the world, the weight of their families around, and they literally aren't talking to anybody. Too many folks in our community do not believe in therapy, so therefore we're not trying to go to see a psychologist or a psychotherapist. And so you got folk walking around carrying a whole bunch of stuff, not knowing or understanding why they're having physical issues. And it's because we're not literally forcing the conversation. A few years ago, I went to a church men's retreat, and it was very interesting. We had a work retreat that Thursday and Friday, and so I didn't get to the retreat until Saturday evening. And so I get to the retreat, and that morning and that afternoon, they were out doing all kind of sports stuff. And I was like, okay, all right. So they had like an evening dinner. And so, all right, so they had the evening dinner, and then they had a service. And so we're sitting in the service probably about 45 minutes in this service. And behind me, I see them bringing in sandwiches and soft drinks and stuff. And I was like, we just had dinner. What are we doing? So I asked the brother next to me. He said, after the service, we're going to have snacks and we've got some games and stuff. And I went, didn't y'all play all day? Again, this is a church men's retreat. I said, y'all were playing all day. And I'm watching this whole thing happen. Now, mind you, I'm literally looking at dudes in the room who I know marriages are falling apart, having issues on their job, having health issues, and they literally are glossing over all of that sort of stuff and immediately going to the games. And I was like, yeah, we got a problem. And so I stood up and I made some remarks, and I was so ticked off, I never even, now mind you, I'd already paid for everything. I didn't even check into my room. I literally drove back home. And what I said is, the problem that I have is there are mothers and wives and girlfriends and daughters and nieces and family members who sent you here to this retreat hoping you would come back different. And the only thing you're going to go home with stories of is how many games you played. And see, we have to sometimes be honest in that too many of us are having superficial dialogue and relationships and conversations and not really dealing with what is impacting us in a very personal way. The past 3 weeks, a very good friend of mine publicly announced that diagnosed with prostate cancer. Another brother, Jay Harris, an Alpha brother, went on Good Morning America talking about the exact same thing. Thursday, I got a phone call from someone, a brother who I knew in Dallas, Matthew Harton, who was a CFO at Dallas Independent School District. I knew Matthew very well. Passed away. Matthew was diagnosed with skin cancer a couple of years ago. And Matthew was a very private brother. Matthew didn't like talking about a number of different things, but Matthew we often play golf as well. And what happened, a lot of times he would be playing and not putting on sunscreen. Got skin cancer, top of his head, and then went to his then went to the rest of his body. Over 2 years, died age of 70. I'm saying that because, so again, something that very basic. So raise your hand if you play golf. Raise your hand if you play golf. Now, I've been playing golf 38 years. Okay, so how many of the guys in here who raise their hand play golf? How many of you, being perfectly honest, how many of you every time you play and you wearing shorts, or even if you're wearing pants and your arms exposed, you will put on sunscreen every time? One person. Because a lot of us have this attitude that, we black, we don't get skin cancer. Yes, we can. Again, that's a health issue. That's a health issue. And see, when we use this phrase that I love people say, health is wealth, which is true. But here's the other thing. Bad health also impacts the wealth of black America. Because the reality is a black man is dying at an earlier age than any other group, and that is having a negative impact financially on the black community. Which means is that we are leaving family members, we're leaving wives and family members who will be here another 10, 15, 18, 20 years after we passed away. And that means that is an income earner who is not here. Black men dying early is impacting generational wealth. So you're now talking about, again, 10, 15, 17 years of earning power that positions your family in the next generation for success. And so decisions that we are making is impacting us in a very negative way. And so by us checking out of this life early, we're also leaving our family with massive amounts of debt that we accrued. And so the phrase health is wealth really means something different to us than anybody else. And so one of the things that has to happen is we have to actually be willing to have conversations that may be very uncomfortable to us, but it matters. A few weeks ago, I was in Houston, and we were just sitting around talking, and I forgot what the heck we were talking about. And my dad said, I forgot what we were talking about. He said, "You not on any medications?" I was like, "No." He's like, "Really?" And again, it wasn't, so I have diabetes in my family. I'm talking about both sides, grandparents, mother, father as well. And so several of my siblings being diagnosed with it. And I'm getting checked. I'm always like, hold up, what range we in? Because we ain't trying, listen, I already hate needles. I ain't trying to do no shots. We ain't trying to do none of sort of stuff like that. And I'm a little different than some other cats. So, you hear this stuff all again, something happens and I'm going to ignore it. No. If I get a twinge, I'm going to be like, hold up, is that going to come back in 20 seconds? Because, again, if you look at how often we ignore things, how we just pass those things off. And then we're not communicating and sharing with a friend or a church member or even a brother, whether it's a fraternity brother or a real brother. We're not doing any of that. And so black men are literally suffering in silence because we are adhering to some silly, outdated notion of what it means to be macho. That to me is stupid. I don't understand anybody who walks around in pain. Ain't no way in hell I'm walking around in pain. That's just not going to happen. Okay? And the crazy thing is, even when the stats are clear, even if we have health care, we still won't go to the doctor. And if I hear one more brother say Tuskegee, I'm going to cuss them out. And I get it. I get it. But here's what I also understand. And we also know this based upon the data. The reality is African Americans are going to typically get better care from a black doctor than they are a white doctor. Those are simple facts. Now, it doesn't mean that's the case of every black doctor. It doesn't mean that every white doctor is awful. But the reality is, look, we know this when it comes to women, no matter even what your income is, that you can be a highly successful, rich black woman like Serena Williams, and white doctors are not listening to you when you are having a child, which is why black women die at a 3 times higher rate when it comes to the issue of having a child, because doctors are not listening to them. And this state is the worst in America on that very issue. And so now we're confronted with a serious fundamental problem. And that is, in our community, we are not being honest and real about the conversations of health, of fitness, of wellness, of what we eat, how much we eat, what we drink, what we consume, what we breathe, what our environment is like. And so we like to push that thing off to say, oh, no, I'm big boned. No, you're not. We come up with a whole lot. See, some of y'all are like, yeah, I done heard that before. She's like, yeah, I done heard that before. And then somebody probably saying, yeah, I used that one before. So, and again, we're not, and so what then happens is what we do is we come up with excuses about the present day, and then when catastrophe hits, then we go, damn, I wish I had listened. When you look at how many brothers are suffering from strokes, when you look at the issue of diabetes, and you look at amputations, literally African Americans get limbs amputated at a higher rate than any other group in this country. And so I am not of the belief that when we look at the health stats that impact us, that somehow those stats can't be changed. I understand systemic racism. I understand bias. I understand access to quality health care. I understand all of those things. But when I look at the fact that we have information, but then many of us are choosing to ignore the information, that for me is a problem. And so if we're going to actually change this conversation, it's not going to happen on a macro level, which is a large level. And see, we're excellent at saying, oh man, we can get all the people in the right room, and then we can get people together, and then we can create this whole program, and then we can do this whole thing nationally. No. The reality is these things have to change on a micro level. And what I mean by micro level, I don't mean, well, the top half of the room versus the bottom half of this room, or the top row versus the bottom row. No, really, I'm talking about seat by seat by seat by seat by seat. And so imagine if we talk about how do we change this. And I talk about this when it comes to voting, when it comes to how do we invest, when it comes to economics. This is literally how the model works. You cannot confront or change what happens nationally if you don't change states. You can't change states if you don't change cities. Cities are changed by neighborhoods. Neighborhoods are changed by blocks. Blocks are changed by streets. Streets are changed by homes. A home is changed by one person in the home saying, this is now how we're going to operate. If I want to save $1 million, I got to save $1. And then I got to be able to save 2, 4, 8, 16, 32, and then go from there. And so the same process has to happen when we're talking about our health. We then have to first isolate, okay, what range are we in? Are we in a danger zone with our health? Are we fair? Are we good? Are we excellent? Where do we stand? Which means that we have to avail ourselves of medical practitioners. Here's one thing that is absolutely insane to me, and I've witnessed this in a bank, I've witnessed this at church. When I belonged to Friendship West Baptist Church in Dallas, we had a nurses ministry. Now, these were the same nurses that if your ass got sick, they in the smocks in the hospital. The exact same nurses. Baylor College of Medicine, MD Anderson, Herman Hospital in Houston. Like the exact same nurses. So after church, they would do once a month, sometimes twice a month, free screenings. They would, folks about diabetes screening, young black people, no, they check your sugar. We the only ones say that. Don't nobody else. You literally ain't heard nobody white, Latino, or Asian saying, I need my sugar checked. But we all know what the hell that means. I need my sugar checked. So they were doing free screenings for that. They were doing free high blood pressure screenings. And with something else. And it was the craziest thing to me to literally see people, no, I gotta go. It's free. It's free. It was the craziest thing to me. Now, I'm ignorant. So I wasn't a part of the nurses ministry, but I am a communicator. So I was the one going, where y'all going? Nurses ministry loved me. Because I was just rolling them in. I'm like, come here. Come get your behind checked. You know you got high blood pressure. Come on over and get checked. Oh, I was calling everybody out in church. So nurses ministry used to crack up laughing because I would call everybody out and make them sit down and get checked. Because why? It's free. How you going to get mad at stick your arm out, check your blood pressure, got it, all right, prick your finger, know what it says. It was the mind, I didn't understand it. Same thing, I was in the bank. They had free checks. People like, oh no, I gotta go. I'm like, it's 10 minutes. So let me tell you what happened one Sunday. So mother comes in and she's with a couple of children and this young boy, I mean, he was not more than 10 or 12. And they check his blood pressure. This boy's blood pressure was sky high. No, sky high. No, it was out of space high. And so they say, ma'am, we need to get your son to Dr. Scissors. Well, I take your money. He said, no, I don't think you understand. No. We need to call now. They had no idea why this kid, who's no more than 12 years old, why his blood pressure was that high. Well, they looked at his eyes and how red they were. And looked at blood pressure number, and they said, no, we have to go to the ER now. Had I not harangued them to get checked, no telling what would have happened to that young kid when they left there. But a free blood pressure check caused them to say, no, he has to go now. And see, we have to actually change our mentality for stuff like that. We literally are going to, if we are sitting here, we got all of these different clinics and this, that, and the other, and I don't understand why we just say, oh no, I'm too busy. Because here's what's going to happen. When you stroke out, you can't go nowhere. Now you sitting there, you trying to get feeling back in your limbs. Now you sitting there begging folk to pray for you, everything. And you could have literally gotten an early warning by simply stopping right there, which means that what you have to do and what you have to do is say, no, y'all getting checked right now. No, we ain't going to dinner. We ain't going to eat nowhere. Guess what? You're going to be paying for your own meal if you don't sit your behind. I use money against everybody. I ain't paying for nothing unless this happens. Now, if y'all want to pay for your own stuff, go right ahead. But that has to happen. We have screenings all the time and people don't get checked. I was just I was speaking at the Black Women's Expo in Chicago. And so we were done, I'm just sort of walking through, chilling. So they had some screenings and one was like, she's like, you want to get screened? I'm like, all right, what y'all screening for? And she said, A1 something. I was like, baby, that's sugar. And so got screened for that, got screened for blood pressure. It was something that's like, all right, cool. And so we did it, 10, 12 minutes, max 15 minutes. I remember I was somewhere else, and it was an event in California I was speaking at, and so when I got done, I was like, all right, time for these screenings, and I'm walking through, they were like, yeah, I was like, yeah, come on. And they had I said, all right, roll the cameras, and they were like, you sure? I'm like, okay, what? I'm already on social media, I got 5 million followers, what, I'm a trip, I said, ooh, people see me get my blood pressure checked. But I purposely said do that, because that's a perfect example. If you know what your number is on a consistent basis, so then when you get checked and that number is 20, 30 points higher, then you know, hold up, that ain't my number. Need y'all to check it again, or if not. I remember once at church, I got checked. My number was about 20 points higher. I had a sinus infection at the time. I knew I had a sinus infection. That's why my number was high. But because I get my blood pressure checked on a regular basis, if we higher than 110/65, we'll give you 120, but if they hit me with a 135, I'm like, better check your machine again, and we'll do it again, because I'm getting it checked on a regular basis. I'm getting checked on a regular basis to make sure I'm not in the pre-diabetic zone or even worse. And so I'm not walking past that. And so we're going to have to be vigilant to literally grab our folk and say, sit your behind down. We're going to have mothers and fathers do that with their kids. We're going to have kids do that with their mamas and daddies and brothers and sisters, because that one singular action could very well save somebody's life. But let's say it's not even saving their life. When somebody gets sick and all of a sudden they now can't work, they can't do family things, now all of a sudden that sickness now impacts the entire family. Now it's caring for them, it's caring for their children, it's now a financial burden, because all of a sudden they may have to have home health care, then they don't have health insurance. Okay, who's filling the paperwork out? Oh my goodness, who's calling the federal government? Who's calling the state? That one illness now can completely engulf the entire family, and it could financially devastate the whole family. Only because we were silent for 10, 15, 20, 30 years and watched these things unfold, and nobody was willing to say anything. I was, in one of the things that we hear happens all the time. Folks are like, well, you know what? I can't afford a gym membership. I can't do this, can't do that. And it's amazing when you start learning very basic things, such as walking is actually free. Now, let's be clear. I know there are folk who say, hey, I cannot walk in this neighborhood. I can't walk multiple blocks. Okay, well, if I can walk between this house and that house, I can walk backwards and forwards, backwards and forwards. Now, I know somebody might say, that's real basic. Listen, I play golf. I don't ride in a cart. I walked 18 holes. That'll be 6 to 8 miles. I did it yesterday. All right, got a remote control cart. We gonna walk. And you tell the difference between your stamina, between losing weight. Also, we talk about drinking water, not drinking. And when you look at, let's talk about also the reality of our community and food. There's a reason we are being targeted. There's a bullseye on the backs of every black person in America when we talk about what is happening with the food industry. When we talk about the type of restaurants that are in our neighborhoods, we talk about liquor in our neighborhoods, we talk about soft drinks that are being targeted. Literally, we over-index. When I say over-index, there are some fast food companies that African Americans are responsible for 40% of their profit margin. 40%. Some others, 50%. Because then we say, yeah, but I like it, but how much are you eating it? How often are you eating it? I hear folks say, man, I love bacon. Okay, but do you eat it 7 days a week? Or 2 days a week? Or once a week? We can start going down the list. What we have to do is we literally have to be personal agents of change. You cannot expect large things to happen, large groups to all of a sudden begin to care about our community if we are not doing this thing individual. So when we hear the phrase, I am my brother's keeper, I'm my sister's keeper, okay, what does that actually mean? What does that actually mean? Now, it doesn't mean you're going to walk over and just like snatch a fork out of somebody's hand. But what it does mean is that you have to be willing to engage in a conversation with somebody. You have to be willing to begin to challenge someone and say, hey, I need you to get checked. And then be vigilant about the check. I remember my dad has an issue with his eye. He was like, it was a cataract issue or something like that. And look, he now has to have a cornea replacement. And I was like, hey, you get the check. I'm going to call back in a couple of weeks. I was like, he probably like, my son called one more time. But again, sometimes you actually have to do that. You have to do that with mothers as well. Black women get breast cancer at a lower rate than white women in America. Black women die at a higher rate of breast cancer than white women in America because they're being diagnosed later. That literally has to change. And so what I want are for individuals to begin to say, no, we are going to be change agents. And then we're going to take that same attitude to our groups and our organization meetings and say, this is how we are now going to begin to change when it comes to how we live and what our health is. What are our baselines? That is, no, we're going to encourage our folk, whether they go to their own doctor, whether they go to a clinic, whether they take advantage of free service, and say, okay, what's the baseline of your health? In terms of weight, in terms of heart, in terms of eyes. A lot of us pay no attention to our eye health, not realizing we're having significant issues there. Not realizing that issues with eyesight could also be resulting of something else. It just really means that we have to take ownership of who we are in our own community. And it literally does start with self. So while we have organizations that are fighting systemic racism, while we have folk who are trying to get more African Americans in clinical trials, because the reality is a lot of the medicine that we see, frankly, does not work for us because how the clinical trials work, those are simply facts. The scientific data is actually there. But what it does mean is that how do we take preventative measures to literally change what we are doing? We have all these people who give amazing advice. But how many of us are truly willing to follow that particular advice? And so what I want every person in here to do, so you can pull your phone out if y'all can see, some of y'all old school, y'all got a pen and a paper. So whatever phone you have, if you have an iPhone, you have a notes section. Okay, pull your phone out. If you have an Android, I'm sorry. Android probably has some type of section, right, of notes. Oh, y'all got notes? Way to go, Android. Okay. All right, I want you to pull out your notes section. What I want you to do is, I want you to type in 10 names. Brothers, I want you to type in specifically 10 men that you know, or young men that you know, but 10 men that you know. And again, this could be fathers, uncles, cousins, friends, doesn't matter. 10 that you know, and when you leave here, matter of fact, you may literally text them right now. I want you to type in 10 that you are committed to communicating with regards to their health when you leave here. Now, why am I saying that? If you've got 150, 200 people in this room, and if 200 people in this room commit to reaching out to 10 people, you now all of a sudden are going to be reaching 2,000 leaving this room. And so there are basic things that you can say. I want you to get your sugar checked. get your blood pressure checked, and you say, and I want you to share it with me. And if you're afraid to go, I'll go with you. We have to actually be the agents of change to make it easy for our brothers and sisters, but especially our brothers, to know exactly what their health status is. When that happens, what they now recognize is a person of accountability. They now recognize that as an individual, I now have somebody who cares enough about me, who wants to be accountable, and I'm going to follow up with that person to ensure that they actually got it done. Now, they may say, all right, I got to call, I got to make the appointment, I got to do whatever. Okay, fine. All right, you go ahead and make the appointment. Do what you do. But I'm going to check back with you to make sure you made the appointment. And then I need the date and the time of your appointment. So your appointment was at 10 a.m. You say, I'm going to call you at 1 o'clock. And I want to know that you actually make your appointment. And I need you to stay on top of that, because this is how we begin to now change this. Now imagine this again. Remember I said micro to macro. So if you know what the issue is on this campus and in this city, now you begin to say, now wait a minute. If 200 people in this room could now impact 2,000, what then happens when 20 churches do the exact same thing? What then happens when, and this is where I want all the folks who are in D9, I want y'all to calculate how many D9 chapters that are undergrad and grad in this area. Same thing. Same with Prince Hall Mason. Same with Eastern Star. Same with Lynx. Same with Jack and Jill. You take advantage of your organizational strength. What may end up happening is you're going to literally begin to change the health awareness of, one, your family, your friends, your churches, your organizations, your city. Now, once you are aware of what your issues are, now you begin to put together a blueprint on how we can now tackle the problem. So what that might mean is, before I was coming here, there's a sister I know in D.C., a group of sisters, they do yoga every Saturday. Okay? That's what they do. It may very well be, you may say, all right, I'm going to do a walking club with my homeboys. We're going to walk 3 miles a day, 3 days a week. That's 9 miles in a week. It will take you it takes me an hour and 10 minutes on a treadmill at a 4 to 5 incline to walk 3.5 miles. It takes that long. Now you might say, come on, dog, man, we walking. Yeah, but you ain't like you hooping anymore. Because part of this whole issue is body movement. Part of the issue that we have when we look at many of our health issues is that we literally are not moving our bodies. We become sedentary. And so you have to create something that says, no, we're going to do this. You ain't going to do it by yourself. We're going to walk as a group. 5 or 8 of us, 10 of us, we're going to meet here. Here's a time. All I'm asking you to do is give me 90 minutes. We're going to walk 3 miles 3 times a week. Who's in, who's not? That's what you'd be able to do. Now all of a sudden, then what's happening is, all right, I'm going to need you to be drinking 50 ounces of water a day. Now, some people can't drink three glasses of water a day. I get that. All right? But again, your goal is eventually 50, 75, 100 ounces, whatever it is. These are some basic practical things that you have to do. And you also are going to have to do something that's also hard for some people. Oh, man. Nope. We are not stopping at the fast food joint. Nope. We ain't doing it. Listen. I know what it's like. I go hard. I'm moving, I'm going, whatever. And so what I do now is I am very practical. It doesn't always work, but I do it a lot where, all right, let me make sure I grab 2 of them green apples before I leave the house. Throw it in my backpack. Boom, I fill up my container with 40 ounces of water. I got a protein bar. It's in my bag. Because now that's going to keep me from stopping in a convenience store and getting a bag of chips and some grandma cookies. Again, and I know somebody's like, yo, I'm there. Oh, I will do some chocolate cake in a heartbeat. Y'all gonna understand, my show, Blackity Black, I'm black. I love chocolate cake. All of my cars being black. I love chocolate ice cream. All the women I know black. I'm just saying. Some of y'all gonna figure that out a little bit later. Y'all just bet you. But my point is, these are basic proactive things that we literally have to start doing in order to change our habits. And experts will tell you that if you do something for 21 consecutive days, you're more likely to continue that habit for an extended period of time. And so what I want us to do is stop trying to make this out to be so hard. I want us to stop trying to make this thing out to be so difficult. I want us to stop sitting here going, man, I need to lose 75 pounds, but that's just way too much. Again, you can't save $75 unless you save $1, and you ain't gonna lose 75 pounds unless you drop 1. Again, and I just believe in, my man Joe Madison, God rest his soul. Joe would always say, you gotta put it where the ghost can get it. And then when people call and complain, he will always end with, so what you gonna do about it? That really is the question that every person in this room has to answer leaving here. Because otherwise, why are you here? Seriously. Why did you come out here on a Saturday? Was it to hear panels? Was it to see the vendors? Was it to hear me? No. You were here to say, I want to be a change agent for me, my family, my neighbors, my friends, my church community, my block, my street, my block, my neighborhood, my city, my state. We know what the numbers are in Mississippi. We know that we are losing African Americans earlier than we should be. We know the lack of gynecologists and health practitioners. We know what's happening in this state. So let's not make it easy for funeral homes to make lots of money earlier than they should. Let's actually extend our lives. And no matter what age you are in this room, you literally can start right now. And if we start now, and all of a sudden, and we begin to see our grandmothers and grandfathers, and our mothers and fathers, and our aunts and uncles begin to do this, I'm telling you what's going to happen. That is going to have an absolute trickle-down effect, because that then begins to impact college-age students, high school, junior high school, elementary school. And all of a sudden, when this thing happens for 21 days and 3 months and then 6 months, then a year, then multiple years, we now are going to begin to see how our families are changing with our sizes, with our stamina, with our health conditions, all of those different things. And when that happens, we're living different lives. We're living better lives. I do not want to continue to have to see black people who are in their late 30s and mid 40s living in pain, in agony. I know too many people who I went to high school with who are not here because they had kidney ailments, because they had strokes, because they had other health conditions. I'll be 57 in November. It is insane that we are burying folk who are in their late 40s and 50s because of significant health issues. And we can't blame everything on, well, that's in my DNA. That's in our genes. No, we actually can change things along those lines. And so let the health practitioners do their job, but they can't do their job unless we do our job. And they all say the same thing. If you do preventative, let me tell you, when I got my colonoscopy, and I got another checkup, and here's the last thing I'll say this here, and this is where Captain Hughes coined the phrase "information is power." And too many of us also overuse Google, okay? Because stop trying to be a Google doctor, because you're not. But the last thing is, when we do go to the doctor, we have to communicate with our families. So when they ask you that question, do you have a family history? And when you go, I don't know, ask Deion Sanders. Deion Sanders has been dealing with blood clots. Deion Sanders did not know that he had a family history of blood clots until his mama finally said it. He was like, "Mama, why the heck didn't you say something?" He had an uncle die from blood clots. Mom had blood clots. Another uncle had blood clots. He learned that he had a family history of blood clots. Had Deion Sanders known that 10, 20, 30 years ago, then he would have known what I need to do later on, and that may have prevented him from having to lose 2 toes, and his leg is being completely mangled. So when we go, so we gotta, and again, this is one thing that black folks simply do not do. We do not communicate because we think it's a family secret. Family secrets are killing black people. So we've got to know who has a thyroid problem, who has breast cancer, who's had prostate cancer, what age did they get it, all those different things. And we go to the doctor and they have that chart and you're filling it out, you can actually fill it out. And it has to go beyond, well, let me just ask my mom. No, I need to know my mama's history, my dad's history, my grandparents' history to be able to put those things down, because a doctor is assessing. Is a doctor in the room? Who's a doctor? Raise your hand. Am I lying? You are assessing, you're taking all of that data, and if you're sitting here going, now hold up, you got sisters and brothers and mama and daddy, that's painting a health portrait of who you are. If you don't have any of that, the doctor's literally trying to guess what's going on. And so we have to be providing them with more information. Last point on that, communication is key. Let me be clear. My doctors and my dentists, if y'all think I ask questions for a living on TV, oh, hell no. I'm in there, what's that? What's that gonna do? How long am I taking that? Did you run this test? What is it? See, I don't let, sometimes a doctor be like, what the hell is I don't let grunts, nothing get by. No, I'm an active patient. I'm an active patient. I question everything, dentist and doctor. All the doctors I've had, my dentist, I got their home phone number, their cell phone number, their email. I am not calling an answering machine. Because also I travel. There have been times when I've been traveling and I know, first of all, I'm allergic to smoke. My mom has asthma. I don't, but I have asthmatic conditions. If smoke gets in my system, it has closed my throat for a whole week. When I get hit, I call doctor, hey, I need you to call a prescription. This happened. I ain't coming home for a week. I'm not going to be sick. The point is, and my doctors know, I am an active patient. I am not trying to hide stuff from somebody who can help me. And so that's what every single one of us do. If the folk in this room do this, I want you to visually see what I'm talking about. I want you to visually see what I'm talking about. And I'm going to use something that happened in our community more than 60 years ago to emphasize this. Do y'all realize that there are more people who are sitting in this room right now than the people who were sitting in a basement in Montgomery, Alabama? I want you to understand. Because, see, I know there's somebody thinking, man, so-and-so should have been here. No. Literally, if you want to lead a health revolution in Jackson, Mississippi, it can literally start with just the people sitting in this room. If the people sitting in this room, if each person here says, I'm reaching 10, and then you require that person, I help you, I need you to now also reach 10. If 200 reach 10, it's 2,000. If 2,000 reach 10, it's 20,000. All of a sudden, what you are sitting here communicating with and learning could transform this city over the next year. So here's what should happen next year when you have the conference, and too many people don't do this here. Y'all need to do next year what is called an annual assessment. We had the conference last year. We saw X number of people. What was the net effect of our work in the last 364 days? That is, not sure how you can track it, but did we see an increase in checkups? Did we see an increase in screenings? Because now what then happens is you are tracking your work. The greatest mistake that happens, and this, y'all, they're saying, this is every group I speak to around the country. We have events, then we come back the next year with another event, then the next year, another event, and what we never do is say, what was the impact of our meeting last year? So what will then happen if all of a sudden y'all come back next year, and this is really what should happen next year. Every person, remember I said you reach 10. If every person in this room says, I am going to personally bring 10 with me, they're going to need another room. I want you to understand that. So which now means you are going to have to do the work because they've already done the work. They've organized this. They've had speakers. They've had panel conversations. They've had information out there. Now it's time for you to be the communicators in your family, in your concentric circles that could change the health of this city, in this state, in this country. The question is, what are you prepared to do? Thanks a bunch.
Thank you so much, Mr. Roland Martin. Roland today has given you a call to action. We've talked about prevention, but
Did you write down 10?
let me tell you.
Did you write down 10?
No, because I'm finna tell you something in a minute.
Did you write down 10?
Go have a seat. Let me show you something. We talked about prevention.
I don't see your 10.
We talked about, but you have the power to progress. He gave you the call to action. He talked about 3 to 4 times a week, 30 minutes of exercise is all you need to make sure you get active. And you said, did I write down my 10? You struck a nerve in a lot of different people today when you said something. You said that not only does your health issues, men, affect your family, it affects you financially. My auntie was here at UMC at the doctor in the hospital, and she has 9 children, and she has 7 boys. One of them was there, and I'm here in Jackson, so I'm the anchor. Chris, go see about your people. So I'm at the hospital. My cousin Pedro, right? He was there, head hurting, eyes bloodshot red, Dr. Melvin, bloodshot red. He says, Chris, stay here with mama. I'm going to just go lay down in the car for a little while. And I said, no, you're not. Hold on, I'll be right back. I went outside and I called. This makes me a little emotional, but because I saved his life, I called Dr. Quinn, who's a friend, and I said, Dr. Quinn, I know that you have patients and I know that it's full, but I have somebody here I need you to see right now. He said, Christiana, bring him on. I took him from UMC. Now, understand, we're at UMC, University Medical Center. You can go straight down there to the emergency room, right? He would have died. I took him over to Dr. Quinn. When I took him to Dr. Quinn, his hair was hurting so bad that the lights. Dr. Quinn tested him. He said, Christiana, I have already called the emergency room out at what is like River Oaks, the women's place. He said, this is a deal. They're going to see you as soon as you walk through the door. If there's something major, they will send him where he needs to be. But don't go back to UMC because he will sit in that waiting room forever. We walked in that room at the hospital, and they said, hey, are you Dr. Quinn sent you Christiana? I said, yes. Bring him on to the back. They rolled him to the back. A blood vessel had burst in his head. And so all I know is they said, hey, we're about to call the ambulance. Go ahead and prepare. So I'm calling my cousins. I'm calling his sisters. I'm like, y'all, we got a situation. We have a situation. They rushed him over. By the time I could see him at UMC, he didn't even recognize me anymore. Mm-hmm. At that point in time, he was going through something. But he was having a stroke, and the blood vessel had burst. But imagine had he went to UMC, to the emergency room, and sat out there for hours. Imagine if he had went to the car and took that nap in the heat.
Right.
We would have found him dead. So I say that because now it transcended through our entire family. Because, yes, he had to go through rehab. Yes, we saved his life, but he's having to go through rehab. Now, when we have our family gatherings, he's embarrassed to come because he's having to redo his left side. And so I said that to say that when you recognize that, immediately take action. It's something simple that you can do right now, fellas. Right now, simply. Cut out the sugar, those sodas. Why you always got to have sweet tea? Not just that, why do you feel you have to have extra salt on your food? His mother was there. She had had 2 heart attacks and a stroke already. Wow. And you said it's hereditary, right? So the doctor said, ma'am, I need you to let go of that sugar. You need to get different, salt. You need to get different types of salt. But imagine those 9 kids. Mm-hmm. Hereditary is because they're feeding us. They're feeding us the food over time. And it can be changed by simply changing your diet. We have to eat more fruits and vegetables. You have to definitely stop adding all of the extra additives. And don't go to the fast food place. I can't tell you the last time I ate fast food. When I ate fast food, Roland, it changed my life. When you exercise every single morning, the way you feel throughout the rest of the afternoon will change your life. There's an African American Wellness Men's Walk that's coming up in November. And fellas, I encourage you to get involved. But also, I wanted to tell you that 3 to 4 times a day, 3 to 4 times a week, 30 minutes, you can definitely do something to change your life now. We greatly appreciate you. You have dropped gems today and a wealth of knowledge. Please give him another round of applause. But now we have to continue on because the sessions are going. Marilyn is like, come on, girl, come on, girl. Okay. Dr. Sandra Melvin, our CEO and founding president of the Institution for the Advancement of Minority Health, will come up to make a special presentation, followed by the men of Alpha Phi Alpha. My suit was made by Alpha, by the way. Uh-huh.
Let's give Mr. Martin another round of applause. He was definitely the right man for the right time. Okay? And Mr. Martin, I do watch Unfiltered, so I did prepare a speech, but I didn't know if I was going to be able to use it today, and thankfully I can use it. All right. So, Mr. Martin, through your groundbreaking journalism, you have given us giving our stories a national platform, and ensured that issues impacting our communities are not overlooked or silenced. From the newsroom to the stage, you have been a relentless advocate for justice, equity, and accountability. Hear, hear. And importantly, you have stood with us in championing the health and well-being of Black men, making sure that our struggles and our triumphs are visible and valued. On behalf of the Institute for the Advancement of Minority Health and the Black Men's Health Equity Council, it is my honor to present this token of our appreciation. This gift represents more than gratitude for your words today. It symbolizes our respect for your life's work and your tireless dedication to uplifting Black voices and advancing equity in every space that you enter. Your leadership reminds us that progress is possible when we combine courage with conviction. We are thankful not only for the wisdom you shared today, and you truly shared some wisdom and gave us a call to action, and we will be doing an assessment, but for the example you set each and every day. Please join me in celebrating Mr. Roland Martin and expressing our deepest appreciation for his unwavering commitment to truth, justice, and health equity.
Can everyone that's a part of the committee please go ahead and join us? But in the meantime, as they take their photos, kind of center to the middle if you guys don't mind. While they take their photos, coming up, we have the men of A-Phi-A. But I wanted to say something really quick while they take their photos about the men of A-Phi-A. An alpha man. I wrote this out while Roland was talking. I didn't write out my 10 guys. But this is what I see when I see an alpha man. An alpha man moves with purpose. When an alpha man enters the room, things don't change because he takes up space. They change because his presence makes space for strength, direction, and growth. An alpha man has always been and will continue to be a leader. So we want to welcome our young leaders to the stage, the men of Alpha Phi Alpha, the Alpha Epsilon Lambda chapter, Gamma Epsilon chapter. Yes, these are our young leaders. And if you all would please come to the stage and kind of so we can get a really good photo of everyone. One of the young men was on my cart this morning, and I looked at him and I said, "You an alpha man. You can tell."
You hear that, Omega?
First of all, let's give Dr. Melvin another round of applause for putting this together. I've known Sandra, as I call her, for about 30 years when she was a student at Tougaloo, and then when we worked together at the State Veterans Commission. So we both have come a long way. So to God be the glory for everything that he's doing in our lives. So this is great. I will be coming back every year. But to my brother Roland Martin, I'm Percy Anderson Jr. I'm the outgoing president of the alumni chapter, Alpha Epsilon Lambda, and we're the chapter that oversees this great, fine undergraduate or college chapter, which I was made in 1982, 43 years ago. And I happened to have been there when my son, General President Skip Mason, gave you your life membership. So congratulations on continuing to stay fired up and remain active over those years. I give you your props. And today was an amazing talk, because I watch Unfiltered also, and I'm very, very proud to say that you're my brother. But on behalf of Alpha Epsilon Lambda, I wanted to present this award of appreciation to Brother Roland Martin in recognition of your unwavering service and dedication to Black America, including Black men's health equity, presented on August 23rd, 2025, Alpha Epsilon Lambda, chapter of Alpha Phi Alpha Fraternity Incorporated. Thank you so much.
Where's the photographer? Right there. Hold up, let's slide back this way. There you go. Right here in the center. Look right here. All right. Got it? All right, cool. Appreciate it.
Good afternoon, everyone. My name is Johnny Crenshaw. I serve as the president for the Gamma Upsilon chapter seated at Tougaloo College. And to Brother Roland Martin, we were immensely happy to hear that you were coming to our college, and we just want to commend you on all the amazing work that you do in the field of journalism and radio and media. So we have small gifts, we have some Tougaloo gear, and we also have Alpha gear for you.
All right, cool. All right, here we go. All right, here we go. All right, everybody look right here.
Yes, put up that Alpha Man sign. Okay, Roland, you're officially a part of Tougaloo. Wear the T-shirt proud.
All right.
Wear the T-shirt proud. Now, before we get up out of here, real quick, we have the Jackson Black journalist that would like to have a few words. Please bear with us.
Thank you, Christiana. I'm Jimmy Gates. I'm the president of the local chapter of the National Association of Black Journalists. And it's such a pleasure to be here and to be here in the presence of greatness, Roland Martin. He probably doesn't remember this, but years ago I met him at a regional conference in Birmingham, Alabama.
Yep, I keynoted.
And we was on a bus together. I think we went to the Civil Rights Museum, and this guy was in such deep conversation. He was talking to then Congressman Arthur Davis, and I was just listening in. I said, this brother's deep here.
Yeah, I was lighting his behind up.
And I wanted to be like him. I know I can't speak as him, but I'm a writer. I've been writing a long time. And I just do want to take this opportunity to thank you for gracing us with your presence today. And I also, when I think of you, I'm reminded of that great journalist Ada B. Wells, what she once said, the way to right wrongs is to shine
the light of truthfulness upon them.
And that's what you have been doing for us. Thank you. And I have this little gift for you here, just because we consider you as our king. I brought this little bit of gift for you here.
All right. Appreciate it. All right. Here we go right here.
Hold on, we got to get that bag out the picture. Wait a minute.
I got it, don't worry about it.
Okay, you got it. He knows what to do. A true king, yes. And is that like the alpha symbol? Yes. I'm learning every day.
There you go. All right, appreciate it.
Thank you so much. And I want to remind you, he said, we brought y'all this little gift. Now, I was told that you never put Lil in front of something unless you're throwing shade. So it's a great gift. Thank you so much. I want to remind all presenters, you need to stop at the registration table before you leave. And Roland's book is available for purchase out front. So please go by and pick up the book. Roland, we're going to ask for you to kind of stay around just for a little bit. Somebody may want to get a picture with you.
Yeah,
or maybe they want to.
Where I'm signing?
Yes, that'd be
I'll
awesome.
take pictures there.
That'd be great. But thank you all. You can go on to your different sessions because it is now time to do that.